Health informatics, or digital health, this is probably the more common term these days, is an old field that I've been in for over 50 years. Through that entire time, despite the enormous potential of introducing digital technologies into patient care and even putting it in the hands of patients themselves, the field has struggled with how best to represent and share data. Because the human body is so complex and the diseases and the nature of the body itself are not fully understood, not nearly fully understood, the data that people use, or the standards that people use to represent that data, are themselves quite complex. SNOMED CT, the Uber nomenclature for healthcare, contains over 300,000 concepts and well over 1 million relationships among those concepts. How to use that, how to package it, how to share it has been an enormous challenge, which after many years of trial and failure is finally being solved by a new approach called Fast Healthcare Interoperability Resources, or FHIR, FHIR for short. This is an Australian invention developed by a guy named Graham Grieve in Melbourne. And we certainly in a short talk can't get into much about what it is, but what does it do? Well, for example, in the United States, where the federal government has been quite aggressive in mandating FHIR, electronic health record systems must now offer patients an API, a gateway, from which they can download their actual digital health records. Apple was quick to leverage this, and today anyone in the U.S. who has an Apple phone can, if they choose to, select their healthcare provider or providers from over 10,000 who now offer FHIR gateways and download their digital health data. Google and Samsung recently announced that something similar called Health Connect. It also means that it's now possible to turn electronic medical record systems into something like the cell phones we all use every day, in the sense that apps can be installed in them and those apps can access the data they contain. This is an exciting possibility that offers a long-sought solution to how best to provide physicians with support for making the right clinical decisions and to provide patients with the support they need to better manage their diseases should they develop them and to avoid having them in the first place. So this is truly the beginning of the golden age of this old field, and I couldn't be more excited to be in it, to hang around long enough to see all this happen. I hope you'll have a chance to explore it with me later on.